Hey guys, Dr. Richardson here from Free My Spine. Today we have Zachary Lehman with us, local plumber. Zachary, how old are you?
26.
26. He's been suffering some mid-back pain. I call it the thoracolumbar region, muscle spasms, decreased range of motion. We're gonna treat him today, fix him up and see how he feels afterwards. All right. Okay, Zach, let's go ahead and lay face down. The huge. All right, so as I palpate, it's pretty obvious the left side has more hypertonicity, which is muscle spasms, even through the shirt. I mean, it's kind of obvious. And the joints are locked up on the left, the facet joints in particular. So we're looking around T7, T8, T9, even up here, T5, T4, all the way up. But the left is definitely more restricted. So what we're gonna do first is set Zachary up here on the mechanical traction. I'm gonna push the button here, and you'll notice it's gonna go up and down, just like that. Nice and gentle. And we're gonna do a little ultrasound. Let's get all that ready. All right. It's gonna be a little cold at first, but it should warm up nicely. So this kind of not only allows the tissues to get warm, but it allows me to also feel more of the tissue, even more specifically, like what's going on in here, you know. You can feel all the bumps and the lumpiness. Zach, if it gets too warm, you gotta let me know, okay? How's it feel right now? Does it feel okay? Like the warmth? Do you feel the heat yet? You should start to feel it soon. Yeah, so right here, that's like the epicenter. That's why I'm focusing on that. Zach, I think this is like your fourth time coming in, about?
Yeah, fourth or fifth.
Fourth or fifth. And then we gave you those prescriptive exercises to do where you bring the shoulders back and down.
Yeah.
Do you feel like those have been helping, or have you been able to do those? Like,
Yeah, they've been helping.
so today I want to take those to the next level and give you like a more integrated exercise to do. And so instead of just doing those, we're going to throw in like push-ups. So you'll be able to do push-ups while you're contracting and bringing the shoulders back and down. It'll make that muscle that much more strong. Yeah, it's like real. So it's kind of, you know, I can feel it's softer down here, even though the muscles are a little spastic. As I go up, right there, it just gets real tough, man. It's like leather. So when I use the Graston tool to beat that up, that should turn real red for us. Get rid of those adhesions. Zach, have you gotten used to the adjustments yet? Or they still kind of freak you out?
No.
You're good?
Yeah.
Okay. All right, now what we're gonna do, we're gonna use a technique called Graston. It's a form of deep tissue or soft tissue release, except it's instrument assisted. So I have this instrument here. It's stainless steel with a beveled edge. I'm gonna glide it across Zachary's skin, and you'll notice it'll start to appear red. It's going to help get rid of those adhesions, smooth out the muscle where it's spastic, and allow for better joint motion, and make it easier for me to adjust him, and he'll notice a big difference when we're done here. So let's get started with that. First, I'm going to glide over soft and kind of smooth, and I already know where the hot spot is, which is right here. I'm gonna get in here and just flatten that thing out. Now, Zachary, if it becomes too intense, you gotta let me know, okay? But you've been through this before, so I think you'll be all right. You're a pretty tough guy. Also, I forgot to mention, Zach, you're a hockey player too, right?
Yes.
So, you know, he can take a beating and probably give one too. I didn't tell you, I got beat up by a hockey player one time. Me and like 3 of my friends. It's pathetic. I mean, he was a jerk. He was a horrible guy. Because he was like beating up on his girlfriend. And so we like tried to rescue her. We paid the price. Eventually we detained him, but not without getting busted up. We figured, we were in San Jose, and we figured at the end, like, he kept pulling our shirts over our heads, you know? And then we all were like, we should be ashamed. We're like big dudes, you know? We were all like at least his size. Man, he kept pulling our shirts over our heads and killing us. Anyways, that was my experience with a hockey player. It's a bad one. Okay, you're seeing this is really getting red, so it's breaking up the adhesion really, really nicely. Zach, you okay so far with this?
Yeah.
It's starting to get you, right?
Yeah.
Okay, right here though. Give me 5 seconds. 4, 3, 2, 1. That's fine. I mean, this is probably one of our more extreme cases. That's a lot of what we call petechia. I mean, that's a lot. We usually don't get that much. And it looks like a giant hickey. That's what it looks like. Now let's get this right side, gliding over it. A couple more seconds here, Zach. Yeah, this is something we do in our clinic all day long. Not a lot of chiropractors do this. It takes a little extra effort, but I find it's absolutely worth it. Patients see a huge difference and huge benefit from it. So you'll see that side didn't get quite as much, but we kind of already knew that coming in, but definitely reacted. So we call that successful. Breaks up scar tissue, breaks up adhesions, allows for better range of motion. And the great thing about that, wherever you see that petechia, your body goes in there and lays down brand new collagen tissue. So Zachary's, as he sleeps and his body heals and he experiences a cytokine release, his body is producing new collagen, new tissue, fresh. And he's young too, so it'll do that rapidly. Let's turn this off. Okay, now we're going to use the Hypervolt. My trusty Hypervolt. And it's just going to help flatten out the tissues a little bit more before we do the adjustment. This thing looks really subtle, but I can tell you it's quite intense. It almost feels like it's going all the way through you, right, Zach?
Feels amazing.
Most people love it. I love it too. All right, very nice. Okay, Zach. Now for the fun part. I still got just one more second. So we're going to start with the base of the neck and the uppermost part of the back. Okay. One more. Oh, nothing on that one. Let's get this side. There we go. All right, Zach, let me have you lay on your back face up. Zach, slide down just a little bit. Right there, perfect. One here, one here. Come straight up for me, tuck your chin just a bit. And drop back. Exhale. Drop all the way back, all the way back. Nice. Nice crunch. All right, Zach. Slide down just a tiny bit more. Right there. Yeah, you're good. See if there's anything left, and then come up and drop. Yeah, definitely was. Just give the legs a little pull. Keep that relaxed. One more. Love the Crocs. Love them. They go well with the pants. That flannel. We love it that you come in comfortable. That's the most important thing. All right, Zach, slide up for me. I know I pulled you all the way down. And then lay on your side. Face me this way. Yeah, perfect. Relax that shoulder. I'm just gonna get a little pull. Hold on. On this one, Zach, I want you to push your hips toward me. Right there. I'm gonna keep this knee locked out. Foot pointed up. Very nice. Quick learner. Get this right there. I already went. Good. All right, Zach. One more over here. This one you relax it. Bring this here. Get the lumbars and the AS on this side. There you go. All right, Zach, can we get the neck? I got you. Let it go. No. Not much in there, just a little bit. Not much on this side yet. That's pretty good. I'll give you one more little pull here. Cool. Let's do the Y strap pull as well. Zach, you ready for the Y strap pull?
Sure.
You're gonna love it, don't worry. Zach, slide down a little bit for me. We haven't done this one on you yet?
No.
Okay, lift your head. It's basically what I just did, slightly more intense. All right, drop your head back. I'm sure you'll love it. Okay. If it's uncomfortable, I'm gonna do like 3 oscillations where I'm pulling. If it's uncomfortable, let me know. So far, you okay? All right, one more, we're gonna go fast. You okay?
Yeah.
Did you feel it?
Yeah.
All right, Zach, let me help you up. That one's not for everyone. If it's not for you, you let me know, okay? How'd you feel after the treatment today? Did you feel like it helped at all?
I feel a lot better.
Okay, great.
My
Even during the scraping when we're gliding
Yeah.
across the skin like that? So for
Yeah.
some people that can be pretty intense. I understand
It gets a little intense, but nothing unbearable.
Okay, very good. Yeah, people want to know because, you know, when you do it, it looks like, you know, there's almost, you know, blood's gonna come out. So we don't.
Yeah, gets a little intense in the moment, but definitely helps.
Yeah, you feel the release.
Yeah, you feel a lot
afterwards.
better later.
Yeah, that's it. So yeah, another successful treatment here from Zachary. Appreciate you coming in.
Appreciate
And
it.
we'll see you next time. All right, Zachary. Thank you, sir. Bye, guys.